Okay, here we are. Thank you everyone for joining us today on the Zoom screen here to host an update meeting between all of our partnering organizations here in Fort Dodge and Webster County. And I'm just really pleased that everybody could get here today. We have folks from myself from the city, county supervisor, Fort Dodge Schools, St. Ed's, Iowa Central, Unity Point, Public Health, and also joining me here in the Fort Dodge City Council chambers are Senator Kreinbrink and Representative Meyer. So just a quick update from the city. We have sent out some additional press releases over the last couple of days, encouraging social distancing and stay home, stay safe, stay healthy, normal sanitation, normal operations within our Public Works Department, and our Fort Dodge Fire and rescue groups are implementing new protocols to deal with keeping their employees safe and also those that they serve safe. Same with our Fort Dodge PD. They're implementing some new strategies on how to keep their cars sanitized and keep their employees safe and deal with any type of transport they have to do. So things are going good with the city. We're meeting on a daily basis to try to keep communication lines open amongst ourselves. And it's just great to be here with all of you today to hear about your organizations and what's going on in our community. With that, I was gonna work through this agenda, which I have to move around on my computer screen here. I was gonna ask if Unity Point, would you be willing to go next and give an update? Leah?
Yeah, Matt, thank you so much for inviting us to be here today. We really appreciate the collaboration that we've experienced working with all these community partners to respond to this unprecedented time with COVID-19. I would be remiss if I didn't start my discussion today with a thank you to our physicians, our team members, and all the people that sit on our boards to help us really coordinate our efforts to respond to the disaster that we have at hand. They've just been amazing, doing a great job at the front lines and really leaning in to the things that we need them to do. So a big shout out first to those folks. I just wanted to say a few things about our preparedness and then also the ways we're decreasing exposure and conserving supplies. So from a preparedness standpoint, our incident command has been meeting for the past 4 weeks. We have a group of people strictly focused on our response to COVID-19. And so we've been working really hard to be prepared. I've told my team, and I will say it here on this, our community has been given the gift of time. And that has surely been a huge gift to us as we have developed surge plans for the emergency department and inpatient unit. We're able to plans to more than double our capacity should we need that to serve our community. We have filed for the waivers for the state to allow us to do that and are waiting to hear back from them, but we don't expect any challenges with that. We also most recently opened our respiratory clinic to help move the volume of patients seeking care for respiratory, to move them to our Second Avenue. Just call your doctor, we'll get you to the right place. As we've been saying in the past, call before you come. That's the most important message from us so that we can get you care in the right location. I want to talk about decreasing exposure in our supplies, really conserving supplies. That's a big topic that's been on the news. You may have read, we are postponing elective procedures. We're canceling non-essential clinic visits, non-essential hospital services. We've restricted visitors to our facility. That's been probably the toughest one for us, knowing that families want to be together, but for everybody's safety doing that. And then we've allowed a large group of our team members to work from home. So that has protected them for that. I think the biggest question I'm getting is do we have test kits and do we have ventilators? Seems to be the topic of discussion from a lot of people. I want you to know that we have test kits. We're testing people every day. Our clinicians are remaining vigilant of following CDC guidelines to make sure the right people get tested at the right time in the right place. We're getting results back every day, so that process is working really well. As far as the ventilators, we have increased our capacity, our supplies of ventilators, so that we can support the need. And the most important part to know is that being a part of Unity Point Health system allows us to get resources from different locations. And so what we might not have on hand today, we can get from our partners. We're also partnering with the 5 critical access hospitals that are part of our region. And so, they too have supplies that, we may need at some point. So we are ready, and our team has been working really hard to get us there.
Leah, one of the biggest resources, of course, that I think a lot of people are interested about, and it makes me think, what about your resource of people? Can you tell us a little bit about what you're doing with keeping your people in good health themselves and also in a positive way?
Yeah, thank you. That's a great question. Obviously, starting with our people, important to end with them too. We just launched a new policy where all direct caregivers are wearing masks at all points of contact. So if you're a direct caregiver, if you're coming to the hospital, you may see our caregivers in masks before they even come into your room, whether you have COVID or not, or whether you think you might or not. So we're using masks to test people we're using masks for all of our employees on the front line. And so that's really important. You may see when you come in partitions at the access points, whether it's with the pharmacy or in whether you're coming and if you have an appointment, our registration folks, we've put up barriers to protect them. We are really making sure they're staying informed. We think information is their best weapon to prevent them from getting ill. We're also doing things for mental health, like daily meditation. We just started doing meditations over the loudspeakers every morning. That's been really cool, well received by staff. And I think what's been most impressive is the change in our HR policies. We now have child care reimbursement available to people who are now spending more than they usually would because their kids aren't in school. We're doing we've changed our process surrounding low census time. So a lot of things just to help people keep their paycheck coming. So, and protect them from being ill and protect their mental health. So all of those things together, I think our intent is to really keep our team members supported.
That's awesome. Thanks for the update. A lot of good information.
Yeah, hey, thanks for letting us be a part of this.
Yeah, we appreciate the update. Up next on the agenda was public health, and our friends over there, Carrie Prescott's with us today. Hey, Carrie, would you give us an update?
Yes, again, thank you. I echo what Leah has said. We're very thankful for our staff as well, and we're very thankful to be part of the community to coordinate care and take care of the citizens in Webster County. So a quick overview of what we in public health are doing. Our agency is considered an essential service, meaning our staff are working to respond to the governor's public health declaration. Some of the activities we're doing is we're following our emergency plans that provide guidance for situations exactly like this. Our primary focuses right now are coordinating community services and monitoring the health of the county. We are here to provide accurate information. We have a Facebook page and a county website, or you can simply call our agency to get information and ask questions. We are making sure agency programs such as our WIC program, all of our child health programs, general assistance, family planning, and especially services to the elderly are available and coordinated in our community. We're monitoring the health of the county. We coordinate weekly with our partners, the hospital, medical providers, long-term care facilities, group homes, to follow up on any concerns that they may have. We're also monitoring the PPE needs of the county. We have called churches, daycares, social service agencies and organizations, schools, the community foundation to assure a coordinated delivery of services in our community. Unfortunately, part of our job is enforcement of the governor's declaration about closings and social distancing requirements. So we have staff that are connecting and contacting agencies that maybe need a little extra guidance on what this means in our community. That's what we were doing in our public health department. I want to say a shout out to our staff too. We have been working continuously, making sure that we follow through with our emergency plans. So.
Hey, Carrie, a question I'm getting quite a bit, and you mentioned social distancing as well as Leah did, and I kind of talked about it too. Is social distancing really working? I mean, is there a way you can tell us about social distancing?
That's great question. We're getting a lot of those calls too coming into the agency. They are. What we are doing is working. We may not see these results overnight, and we may see positive tests come into Webster County. We may see more sickness come into the county. You may feel like giving up, but don't. It will take time. My concern is in the next few weeks, we'll see people getting restless, thinking one quick get together or one quick play date or one quick visit to the store for non-essential items won't matter. But I'm here to tell you that they do. These quick actions to recreate a social network that we work so hard to instill in our community. We'll get the, if he can do it, then I can do it mentality. It will creep back into our community. What I want people to understand is it's normal to feel anxiety, discouragement, disconnected, and even being overwhelmed at times. This is normal in times like this. But the message needs to be you're not alone. Stay calm, remember to breathe, and to continue on. Stay strong, do your part in our community, take ownership, and just say, we got this.
Awesome message. Thanks, Carrie. We heard from our two major health partners, and also joining us today is schools. Dr. Kenny, would you start us off with an update of what's going on with Iowa Central?
We got some good news. We went live today. So all our students over, last 7 days to a little bit over a week, our faculty and staff, I can't say it enough of how great they were, have kind of risen to the challenge. And we now have our classes went live today. Getting a lot of good feedback from them, in regards. I think a lot of it was the students were glad to be able to see each other, even if it was social distancing through what we're using mainly in our classroom Zooms. They're seeing people, they're talking to their buddies again and things like that. So had a lot of great feedback throughout today, in regards to that. Continue to need to update our services, how we're providing education, tutoring, things like that. So we kind of changed day to day in regards to that. Been able to keep up with our faculty and staff real easy, and definitely our students into that. We have closed our buildings to the public. We went to the minimal staff. In fact, the building that I'm sitting in, usually we probably have 50 to 60 people in the day. We're down today. We have about 8 of us floating around this building itself, mainly because to help that. We really pushed remote staff and getting staff at home at working. Even on the child care, we knew we would run into a lot of child care issues because we have a younger staff. But, with the medical professionals out there that have to be in, if we can get our faculty and staff at home, what are important things. So all our tech team has stepped up. We purchased a lot of equipment. So now our faculty and staff can be at home doing their jobs, just a few people within the buildings, because we got to continue payroll and different things like that as we move forward. But our incident command team meets every morning at 10 o'clock. A lot of what we're doing is adapting to the changes out there. How are we going to change in the next few weeks as we go forward with this? I know right now we're saying we're going to try to reopen April 3rd. We're going to be evaluating that through this week, and definitely probably pushing some dates back as we continue to move forward. But, I think the most important one we got today, or a picture I got, was our nursing students. We got to continue to educate our workforce, our future workforce. So we got to keep pushing forward to get the welders out there to the community. Our nurses, the nursing students that we have, getting them trained, getting them ready to start facing and coming out and be able to fill those critical positions coming up into the future. But we continue to monitor it. As I say, I can't thank our faculty staff enough. It's been amazing what they've come forward with and how they just kind of thinking outside the box. So we're excited. A lot of good things going on here. at Iowa Central, will continue to push forward to create the workforce for the future.
You got a big campus, Dan. How are you dealing with cleaning your facilities and dealing with all the stuff you might have to get cleaned up before you can even look to the future of having people back in the school?
We're keeping up on it, thanks to our custodial staff and what they're doing. So one of the things that we instituted here, we've already started deep cleaning our facilities as people have moved off. But unfortunately, I know people have to come on, but instead of going in and deep cleaning it every night, we've set up a system where there's a door hanger like you see in a hotel that's on the door and says this area has been cleaned. So our maintenance crew can walk through in the evening and say, hey, this faculty member came back, got some stuff out of their office, so they can go in there and deep clean that. So we're continuing to monitor that, just to A, keep it clean, but B, to be able to get it ready to be reopened up. We don't need them, because you said we've got a lot of buildings, a lot of offices. So every morning I come on, my cleaned office sign is on my door. I remove it and I'll come back and clean it this evening in regards to that. But that crew has done a great job. Definitely, as we continue to try to stop this spread within our communities.
Awesome. Thanks for the update, Dr. Kenny. Dr. Ulrich, with Fort Dodge Schools, would you care to give us a quick update of what's going on with the school system?
Absolutely. We as well are down to a limited number of our essential staff on site. We are getting a couple of questions of why are there people in the parking lots? Well, we have essential staff, so they have to drive to work and come into the buildings. But we have severely limited the number of people within the building down to they're there for a specific purpose. Our grab and go lunches are continuing to operate. Those locations are at Riverside, Cooper, Duncombe, and Butler Elementaries. The grab and go options are for children ages 0 to 18. Doesn't matter your income level. It doesn't matter where you go to school. Currently, we're serving just under 500 meals a day, which are fairly successful. We are getting questions about, well, could we possibly utilize this to feed the elderly or some other populations or groups? We have to follow USDA guidelines. So the guidelines right now, until we're told differently, are the 0 to 18, no questions asked students coming up for those meals. Teachers are communicating with families about enrichment activities that kids can do at home. Just a reminder that these are optional, they're not graded, they're not part of their coursework, etc. Honestly, the most important thing families can do right now is to connect with each other and monitor the social and emotional well-being of their children. Again, this isn't a competition, and parents aren't going to be judged on the activities. I know there's some social media pressure, just like when you see all your friends in Cancun on a vacation and wishing you were in Cancun. Well, just because your friends are posting great activities of their kids doing things that you're not able to do doesn't mean that you're a bad parent. In minimum, if you can simply have your kids read 20 minutes a day, that's going to make a positive difference when they do come back. We are preparing for students' return April 13th. I'm going to be bluntly honest with everybody that it does us no good to speculate otherwise. And when you look at how quickly things are changing, literally hour by hour, reality is we're nearly 20 days away from potentially welcoming students back. So it's really wasted energy to try to predict and well, what ifs and all of those types of things. And finally, I just want to thank our staff who continue to work on a day-to-day basis, serving our students and families who are not in our walls right now, but that doesn't mean that serving students ends. So a big shout out to them who continue to serve our families.
Great message. Thanks, Dr. Ulrich. I noticed one thing, or I heard that you guys are going to continue to pay your staff, and I know that was probably a decision that you and the board had to work through. Can you tell us a little bit about that? And I personally think that's fantastic that you're doing that.
Yeah, I appreciate that. The silver lining for schools in this whole thing is a reminder that we are so much more than a school. We are truly an economic driver within Fort Dodge and within our region. We're the second largest employer when you include substitutes, et cetera. We employ over 700 people. So with the ability to continue to pay our staff, as long as we continue to receive state aid and keep those folks employed on an on-call basis and continue to provide some services. If we wouldn't have taken that approach, if we can imagine a business here in Fort Dodge with 700 employees suddenly closing their doors, that would have a huge economical recession for Webster County and Fort Dodge specifically. So the board did the right thing, and I commend them for doing the right thing. And as long as we continue to receive state aid, and as long as we continue where students do not have to make up the time, we're going to continue to pay staff and keep our economy rolling as much as we can.
It's awesome. Thank you. Also with us today is Mary Gibb from Fort Dodge Catholic Schools. Mary, I know you've got a lot of activities that you've been working on too. Could you give us an update?
Sure, we've got this. Anyway, I'm just trying to stay as positive as possible, but I would like to really thank all of you that are on this podcast, as well as all the Webster County officials, Governor Reynolds. I mean, I really feel it's kind of brought our community together. I'm working with Jesse and Dan very closely with a lot of things, and I think it's bringing our community closer, and you know, that's not all bad either. So thank you to everybody. We have been in constant contact with our students. Our teachers have been fantastic. I mean, I'm on every email they send to the families, and they're amazing what they're sending out. We've also set up a landing page on our website so that you can just go right there. It's labeled COVID-19 and just see everything that I've sent out all in one place, so they don't have to dig through all their emails. We've also had the priests prepare some spiritual resources for our families. We're live streaming Mass, daily Mass, Sunday Mass. Also, again, working with the Fort Dodge schools, the grab and go meals that we've been able to offer our students. I don't know how many are coming, but that's just a fantastic thing to offer to our families. We're also paying our hourly employees as well. We don't have near as many as the public school, but we also believe that that's the right thing to do, and just keep the morale up at this time that is uncertain, and just keep moving forward and offer any assistance. I'm available. I've been coming in, getting textbooks, getting musical instruments, whatever the families need. I just say, send me an email and I'll get it, and I walk it out to their car and hand it to them. So just being here for them for whatever needs they need.
That's great. What's St. Ed's in the Catholic school system doing with the learning while the kids are home for the next 3 weeks, or we hope that just the next 3 weeks? What are you guys doing with reaching out to your students on their learning processes?
All right. Well, we're just like you guys have said, we're hoping to be back April 13th. So we're planning and preparing for just that time frame. We know that can change, but we're really stressing to our families to just take care of themselves first and foremost. Take care of them, take care of their students. Don't get so stressed out. Try to breathe, relax, slow down, connect with their family. And then, when everybody's stressed in the house, it's not going to work for mom to be trying to be a teacher when she's yelling at the kid. And we got to relax. And like Jesse mentioned, the grading isn't going to happen. We just want to keep some sort of learning going through these 3 weeks. At the elementary level, we're trying to keep up with the spelling, the math, little reading here and there, just to keep their brains working. That's through email. We also have some packets available if a family doesn't have internet. Middle school and high school, all our 8th through 12th graders have their own computers, so the teachers are emailing them through Google Classroom, also emails. I think the 6th and 7th graders are just making TikTok videos, so I mean, whatever works for them, I guess. But no, in all seriousness, their teachers are also providing them daily emails and just everything to keep their minds working and engaged. Next week, I've got a couple things planned, kind of fun activities, virtual activities for the students to get engaged in, just to give them something to look forward to. Our students aren't used to staying in the house all day, every day for 4 weeks. So we need a little sunshine, and we need some nice weather so they can get out and just run around in their yards and jump on a trampoline by themselves. I don't know, but just keep it going in the right direction. Be positive. So I'm just here for all my families if they need anything, and we'll get through this. I just keep telling them this will pass. We'll get there.
Awesome. Thanks to all three of the schools for joining us today. It sounds like you all have great things going on, not only with your students, but your staff, and really appreciate the update from our schools. Joining me here in the council chambers today are Senator Kreinbrink and Representative Myers, and I'm gonna let them come to take my seat for a minute and jump on this webcast and give you a little update from their perspective. So just 1 second.
Hey everyone. So we did a few things in the legislature to start with. First of all, we suspended for at least 30 days and passed a resolution that the governor can appropriate emergency funds when needed. So she has a little bit more flexibility in case we don't go back early enough to address this year's budget. The budget will be funded at levels that are 2020 levels. However, the schools will be funded at the higher appropriation with the SSA because that's already gone through. What's the state doing to address what's going on? Number one, the governor has updates every day on what's going on in the state. So she addresses the number of cases we have, the number of negative cases we have. Unfortunately, we're all very saddened that we did lose one person in Dubuque from coronavirus. We have set up a new website in Iowa to keep those statistics current, and that's coronavirus.iowa.gov. So you can get onto that website anytime and see what the current status of the virus is around the state. A couple other things we've done. We know that number one, what's been talked about already, social distancing is very important. So if a person is sick, we want them to stay home. But a lot of people won't stay home when they're sick because of financial reasons. So governor has addressed unemployment issues. So if someone needs to file for unemployment, they can do that right away. We also know that small businesses are suffering right now. We all want to support our local businesses as much as we can. So restaurants, bars were given the okay for carry out, and but that's not all, those obviously aren't all the businesses that are affected. So there are several small business plans in place. And that just today included sole proprietors. So one owner in one business. We had Senator Kreinbrink and I had a conference call with Iowa Economic Development today, and so all of those resources are also available on one website, and that's on my Facebook page, and I can't really remember what the address to that site is. So again, Governor Reynolds is working nonstop to address this. We have a really strong leader in her, and I hope the state feels confident because she is working really hard to address this from all angles with our Iowa Department of Public Health. And the senator and I, on an individual basis with constituents, we've had a lot of individual constituent concerns just pertaining to them. We've been working as a team to address those, and we encourage you to reach out to us with any concerns you guys have. So that's what I have for an update, and I think everyone in our city and county are doing a great job, especially the schools too. You guys are doing a great job. So if we can just keep this up for as long as we need to, and everyone give prayers that this is going to pass pretty quick. Thanks.
Thank you, Representative Meyer. I'm Tim Kreinbrink. I'll let Matt off the hook and I can introduce myself. But I just want to let you know that we are at a time here where, we have a virus that is very new to us, and we also have a reaction to that virus that is really pretty new to us. And so a lot of us don't really know how to act in this period of time, what to expect. So like everybody has said previous to me, we just gotta kind of take this a day at a time. And I know that it's kind of interesting because I think a week ago, Monday night, we were finishing the legislature at about 11:30 in the evening or before midnight. And that was only a little bit over a week ago. And it seems like it's been 10 weeks ago. So I can imagine what it's like to have the families at home and everybody, kind of confined to that small area. The weather hasn't been the greatest, so everybody's kind of been together. I do want to say though that, if you are sick, or if you have a fever, or if you have a cough or shortness of breath, do be very respectful of others, especially be respectful of our compromised population. And I think that's the most important part. It's not only about you, because chances are you're going to get through this virus, but be careful on who you are around or who you get close to. Just make sure that you stay away from the people that you feel are compromised. And some of those people, you don't know if they have asthma or some other underlying sicknesses. So it's better just to do the social distancing. As the weather gets a little nicer, I think we're all going to want to get outside. And I think Carrie had talked to this, that you're just going to say, okay, let's just get together for one event. I still think it's best to go for walks and get out there and get some fresh air with the family and wave at people. You don't have to hug everybody you see, and just try to stay a good distance away. I think social distancing is probably going to be our number one habit that keeps everybody as healthy as we can possibly get them. One of the questions that I've been getting, and we're going to ask our own question to ourselves, but what happens to our student population if the governor comes and says, okay, we're not going to meet again this year, that is it? Does that mean that, we're not going to go back to school this school year, and we're not going to have any instruction until late August of next year? If anything, I think this COVID-19 has kind of awakened us to a point to maybe catch up with some other states as far as being ready for online learning. It's something that maybe as a state we can say, okay, we have to have this ready just in case something like this happens in the future, or something else happens in the future that we're not able to go to school for a period of time. So I think that's one of the things that I'm going to push very hard with our education director, is to make sure that our schools are ready for that. You also have seen maybe some of your kids in your homes get some assistance or contact from a teacher, and others not. Really, I think there's some federal rules in place right now that discourage that, and actually probably make it illegal to do that. And so we might need the federal government to come in and help us on some of those issues, as well as to relax some of that, especially during times like this. So if we are ready to do one-on-one notebook type instruction, that we are ready and able and are going to do that kind of instruction. The other thing is, economy wise, I know that Dr. Ulrich talked about, the 700 employees. I'm hearing from a lot of our independent contractors, a lot of our independent business owners that are only one person or 3 people. There's not help out there quickly for all of those. And when this is over with, and when we're allowed to get out and go again, go patronize those businesses, help them out, get them going as quick as we can again, because we don't want those businesses and people to leave our communities. We don't want them to have a bad experience and have to close their doors, because we all count on them when they are here. So get back in the saddle, kind of like Mary Gibbs said, we got to stay positive. We have to, this is going to be over, hopefully sooner than later. And when it is, let's get back and patronize our local businesses so that they can survive and continue to thrive in our community. Thanks.
Well, I'm back. Up next and is going to wrap us up for our web meeting here today is Mark Campbell, our Webster County Chairman of the Board of Supervisors. Mark, do you want to share what's going on with the county with us, please?
Hey, Matt, how are you? Thank you very much. I've got two people here with me today, and I'm going to let them both have a few minutes to talk and update you. Sheriff Stubbs and our Director, Coordinator of Emergency Services, Dylan Hagan, are with me. So I'm going to turn it over to them real quick, and I'll be right back.
Hello, just a little update on the Sheriff's Department or law enforcement in general. We have implemented quite a few different things, basically because we're in some uncharted waters now for us. It's not uncharted for other places around so much that have experienced things, but it is for us. We've eliminated a lot of contact in the LEC. You can't come in and do things. You can do a lot of things online. The state has made it possible for us not to do a lot of civil papers, which requires a lot of contact. And so those are down. And also in the jail, we have a screening process before they go up to jail. The jail obviously is the main concern for the county, because it's a confined area. There's no social distancing up in the jail. So we have to deal with that, and we have to deal with it the best we can. I think that a lot of things that came to play, the disinfecting of the cars, we've taken in different procedures for disinfecting cars, computers, everything in the vehicle, everything in the office. So we'll keep doing that and hope that our efforts are not brutal in that respect. I think the people of Webster County need to realize that everybody's dedicated to help them. And if you look at the people that are involved in this, there's a lot of great people that have a lot of community involvement and really want to do the best for the people of Webster County and the surrounding area. And all we ask is that you work with us some too. Some things are going to be an inconvenience, and they probably aren't going to change some things, but some things will change back in time. That's the plan, but it's going to be an inconvenience for a while, but hopefully it's for the better of everyone.
There I am. It's just slow. Okay. Basically, we're just at the county level, we're making sure we have all the resources we need. We've gotten a few donations. Continue to work with Ron and Public Health to coordinate our responses in that aspect. Any donations or things we're receiving, we need to make sure that we are keeping track of. There is federal reimbursement available for supplies that are going into this process. So if there's any questions, anybody can reach out to me at any time. So that's about all I have.
All right. Hey, I want to thank everybody. This has been an outstanding meeting, and Matt, I appreciate you working hard to get this put together. Here at Webster County, we just got done this morning meeting with all the department heads. We're trying to keep everybody up to date and coordinated with all the efforts that everybody in this meeting has been putting together and putting forth. The courthouse and the county is up and running, and we're doing our best to keep it as normal as possible. We have a substantial group of employees that are working from home, while others do continue to come to the courthouse. There is a large group that does work at home, and we appreciate their efforts from there. The courthouse is taking payments, is still recording papers, is still issuing building permits. The parks are open, and we're doing our best to keep everything as normal as possible. We want to thank everybody for the cooperation and the collaboration that the EOC has done. Carrie Prescott with Public Health, Leah with Unity Point Community Health Center. We have some absolutely amazing partners that have put a lot of time and effort into this, and we really appreciate everything they are doing. And again, I think I want to really reiterate what everybody has said before. If you don't have to be out and about, please stay home, stay healthy. And, you know, I guess to end this, Matt, we are truly blessed to have the people that we do on this team. Dr. Kenny, Mary, Jesse, Carrie, and Leah, and I know I'm going to miss people, and, you know, Tim, thank you for everything you guys have been doing. We couldn't do it without all the partners that we have, and the collaboration that we really trained for is really showing in this current really fluid time.